Hi, I'm Steve Murphy, and welcome to the Insider Exclusive. Today, I am pleased to present Dr. Bhasker-Rao on America's premier doctor series. Stay tuned.
This surgery has been endorsed by the Surgeon General of the United States, by Medicare, by the NIH, and the American Society for Metabolic and Bariatric Surgery. This is based on evidence and multiple studies that have been performed in the past where they've compared dieting versus surgery. And what they found was that surgery is the best means now for sustained weight loss, the weight loss in the long term.
They used to see my high school picture, and my oldest would say, "Grandma, when are you going to look like this?"
I'm able to walk further now. I can walk up to 5 miles, where before walking around the block made me tired and winded. Just before I came in for the surgery, my doctor had told me I was about to be diabetic, and my blood sugars are down now, and I'm feeling better. I have more energy.
It changes your whole outlook on life. I think when people are morbidly obese, you kind of stay in the house. You don't want to go out because you're always, people are looking at me because I'm so big.
I have a lot more self-esteem, self-confidence.
Yeah.
I look at the world differently now. I go out instead of being in the shadows. I make myself known. I let people know that I'm there. I'm not scared anymore.
I never had very much confidence. I always would go on these diets and I'd lose some weight and I'd be excited that I was going to be this new thin person, and then I'd hit a plateau, and that was it. I would not lose any more weight. I felt like I was spinning my wheels, and now I just feel like I have the tool to use to keep this weight off for the rest of my life.
I want to welcome you to this show, Dr. Bobby. A lot of people speak very highly of you. You have done over 600, is it 600 gastric bypass surgeries?
Yes, along with lap bands.
And
yes.
lap bands. And people come from all over the world because you have a specialty and a rarity that a lot of people can't find with a very serious type of surgery. Who is a likely candidate for this kind of surgery?
Typically, it's patients who've been struggling with weight for a long time,
Yes.
have tried all sorts of weight loss programs out there, and are at least 75 to 100 pounds over their ideal body weights.
Mm-hmm.
And the NIH has actually set down guidelines, and they've defined it as being 100 pounds over your ideal body weight with or without comorbidities, and being greater than 75 pounds over your ideal body weight with associated comorbidities.
Right. One of the important things about choosing a surgeon is making sure that they're board certified. What does that actually mean, and what board are we talking about?
When we say that we're board certified, what that really means is you're board certified by the American Board of Surgery.
Mm-hmm.
And this takes a significant amount of training, and then you're allowed to take an exam that qualifies you for certification, which is a pretty intense exam.
Yes.
And then you go through oral examination by a bunch of well-published authors in terms of general surgery books.
Mm-hmm.
And you have to pass these exams, and then you are honored by becoming a part of the American Board of Surgery. So they essentially endorse you as a qualified surgeon to go out there and perform surgeries.
Right. Obesity in America is a big problem. I mean, everywhere you turn, there's people that are overweight. Is this probably the best method, surgery, to help people get on the right road to correcting their weight, to getting on a better health program?
Absolutely. This surgery has been endorsed by the Surgeon General of the United States,
Okay.
by Medicare, by the NIH, and the American Society for Metabolic and Bariatric Surgery.
Mm-hmm.
Okay, this is based on evidence and multiple studies that have been performed in the past where they've compared dieting versus surgery. And what they found was that surgery, okay, is the best means now for sustained weight loss in the long term.
For the long term, but they have
Right.
to follow a certain regimen.
Absolutely.
Your training was where exactly? Medical training?
My medical training was at Loma Linda University in California, and my surgical training was out in New York at Brookdale University Hospital. And then I completed a specialized fellowship training, which is above and beyond general surgery, where we focused on minimally invasive surgery.
Right.
And what that essentially is performing major operations with tiny little incisions on the belly,
And
therefore less trauma to
Right.
the patient.
And I understand your typical medical procedures involve that type of surgery, is it?
That's correct.
What are those typical procedures?
The laparoscopic Roux-en-Y gastric bypass
Yes.
and the lap band.
And explain that to our audience. I think you have something here to show us.
Absolutely. We can go ahead and go over the lap band very quickly. Okay. Typically, this is the lap band. Okay.
Yes.
It's a device that's placed around the top part of the stomach, and if the stomach is up against us this way, and this is how it sits, typically on the inner side.
Yes.
Okay. And basically what we do is we dissect around the stomach. We place the band around the top part of the stomach to create a small little pouch right above the band. And that's all the stomach you would have to use.
That's essentially your new stomach.
That's essentially your new stomach.
Okay.
So when you eat, food comes down the esophagus, and as soon as the little pouch fills up, it stretches and it sends reflexes back to the brain saying that you're full.
Okay.
So you're tricking the brain into believing that you're full with small quantities of food.
And this is approved by the American Medical Association? and
Yes,
everything?
it's FDA approved. It was
Okay.
FDA approved about 6 years ago.
So in that whole collar at the top of your stomach with that cord is in your body too?
Right. The advantage of this band is that it's adjustable.
Yes.
So basically we put this band around the stomach, and this tubing here, okay, is connected to a port. This port is placed underneath the skin, okay, so that we can access this little port. So we can inject saline into this port and therefore tighten this little balloon that's on the inside of the band. Therefore you can tighten and essentially customize the band for patients.
Do people come in and get adjustments?
That's how these patients are actually able to lose a lot of weight. A lot of them will need adjustments over time.
Right.
2 or 3 adjustments until you find that sweet spot. The spot that actually prevents them from eating too much and at the same time not vomiting all the time.
Now when someone eats too much and they have a device like this in their body, what happens to them?
They're unable to take more than an ounce at a sitting. So that decreases the caloric intake significantly. And then eventually they're expending more energy than they're taking in.
Yes.
So that energy imbalance is what essentially causes them to lose weight.
Now describe the other procedure that you use. It's the gastric bypass surgery.
Yes.
Isn't it?
The other procedure that's done is the Roux-en-Y gastric bypass. Now this is a procedure that's been around for more than 30 years. Okay.
And
It's
you've
considered
done-
the gold standard.
You've done 600 of these.
Yes.
haven't you? Okay.
Exactly. Typically what we do here is this is a little bit, it's also performed laparoscopically. However, there's a little bit more to this procedure than the lap band procedure that I described to you